Hi, everyone. Welcome to Flock Talk. I'm Erin Morgan.
And I'm Walker Ball, and we work for the members of the Ontario Sheep Farmers.
Today, we're turning our attention to animal welfare, specifically how sheep producers can manage pain procedures and health issues in a more humane way while remaining productive. Procedures like castration and tail docking have long been part of sheep production, but advances in pain relief are changing how they're done and opening up new conversations about welfare, stress, and productivity.
To walk us through this, we're joined by Dr. Gregory Aitken, a large animal veterinarian and practice owner located in the Peterborough area. Dr. Aitken has been working hands-on with producers to demonstrate Solvet's lidocaine band, a new tool designed to provide local anesthesia during castration and docking. Beyond that, he's passionate about practical, low-stress approaches to sheep care and how pain management can make a difference not only for the animals, but also for producers. Welcome, Greg.
Thank you for having me, Walker and Erin. Excited to be here.
Yeah. Amazing. So let's start off with an easy question. Tell us more about yourself and tell us about your journey in veterinary care to this point in your career.
Sure. All right. Interrupt me at any time if you have questions, of course.
Cool.
But to start, I grew up on a farm in the Guelph area. It was primarily beef and cash crop, but we did also have a flock of commercial Dorsets. Growing up on the farm, I've always loved the animal side of agriculture, but the mechanical side of the cash cropping didn't really suit me very well. So I was also deeply influenced by reading James Herriot as a kid. So from an early age, I always figured that farm animal medicine was probably the direction I wanted to go. I graduated Ontario Vet College in 2012, and I was really fortunate at that time. There was not as much of a shortage of vets. So I was really lucky to have a job lined up here in Peterborough. It was a long established farm practice that hired me, and their main focus was beef and dairy, but they also were pretty progressive on some of the work they did on flock health. There were a few large sheep operations in the area, and it is part of the business that I'm sure you guys know there's room for expansion in. So we were seeing more sheep operations starting up around the time I started here. Nobody was really specialized in sheep here. So it was a really obvious area for me once I'd started and got a bit of experience under my belt to start expanding into. I could get a foot in the door of more progressive veterinary medicine that way. I joined every sheep veterinary association I could in Canada and internationally and went to every conference I could get to. And nowadays I have more of a broad focus on all the farm species, but sheep really have a special place in my professional career because they were where I got my start. Delving deeper into agricultural medicine than just what a graduate level vet could do.
Very cool. Well, we're really happy to have you in the sheep industry.
I hear a lot about how sheep farming is a gateway drug into larger farming. So it sounds also like it was a gateway drug.
Yeah.
So Greg, you were actually at our sheep field day this July demonstrating Solvet's lidocaine bands, which is for humane castration and tail docking. We would love for you to explain the specifics of this product and how does it work and what makes it different.
All right. It's a product I am really excited about. I do like a lot of what Solvet does because they're a Canadian company and because they innovate. They look at where there's an actual need and what producers and veterinarians would like to have and wish they have but don't, and then they go ahead and make it. So this is one of those products. I'm excited about it because anything that makes controlling pain and minimizing stress simple and practical to do on farm is really appealing to me. I believe even if you have a procedure or a medication that has a proven benefit, if it's too complicated or it's technically difficult to do, most farms are not going to consistently do it. So the revolutionary thing about these Lidobands is that they look just like the rubber rings that we use for castration and tail docking already, but they have a long-acting local anesthetic actually built into the rubber. So it's the same kind of drug that a dentist uses that they inject to freeze you. But because it is in the rubber, it means as long as that rubber band is in contact with an animal's skin, it's going to freeze the skin and the tissue underneath. So that tissue will be numb, whether it's the testicles or the tail, they will not feel any pain below that band. So when we are doing castrating or tail docking already with rubber bands, there are options that we could use an injection of freezing or give a long-acting painkiller, but doing those things can be technically challenging, it can be time-consuming, and they don't last as long as that band is in place. So this Lidoband is great because it eliminates all of those challenges. It's the exact same technology to use, same process, just putting it on the bander and putting it in place. So there's no need for new equipment. It's really quick, like 2 minutes of explanation and you can go ahead and do it. And it makes a big difference.
Well, that sounds amazing, but talk to us about the producers who think that this might be an unnecessary expense, because they are more expensive than what farmers would use today. So why should producers be paying attention to pain management in these practices that they've been doing for years, the regular way? And are there like misconceptions around pain and pain management in sheep?
Yeah, that's the exact feedback I get every time I talk about this with somebody. This is an increased expense. We've been doing it forever. You put a band on a lamb and they don't really fuss much. They look a little uncomfortable. They take a bit of time to get used to it, but usually they run over to mom and start nursing and seem fine. So why would we change what we're doing? And it's a good question. It's a very fair question. And without proof, why would you change it? My response is usually a little on the technical side. It isn't a really simple, we have a study that says you gain X more pounds and make X more dollars if you do this. So it is based a little more on the theory. We know that with whatever castration method we use, we're going to inflict pain and stress on these animals. And we know that the rubber bands cause the least immediate pain and stress. So you don't see that pain and stress there the same way you would with some of the other techniques. But studies in cattle have shown that they can measure stress hormones and pain responses over time. And when we use the rubber bands to castrate, that creates the longest duration of long-term pain. So we're seeing elevated stress hormone levels for a much longer time with rubber bands than with surgical castration. And if we have this stress present for days to weeks after castration, then we would classify that as long-term chronic stress. And we know that stress is one of the most common factors or common reasons we would see an impact on an animal's immune system. You stress an animal out, their immune system takes a bit of a hit and it can't respond to diseases the same way. Mm-hmm. And it's long-term chronic stress that really has the biggest effect on an immune system. So especially in these young lambs, that's what we're talking about when we're talking about castrating and tail docking. There's a ton of infectious diseases out there that can have a major impact. And all your producers will know they'll have dealt with something at some point that can really wreck a lamb crop. If you have an outbreak of pneumonia or of scours, diarrhea, or maybe some navel infections or joint infections, lots of easily transmissible diseases that lambs are prone to. And if we stress their immune system at the exact time when they are facing these challenges, even if we don't necessarily correlate band disease outbreak, the science is there that this is a risky practice to inflict stress on animals at this age.
Interesting.
Yeah, very interesting. So to piggyback off of what Aaron said, what are producers who've been using this band? What's their feedback? I'm going to assume that not everyone is going to subscribe to pain management procedures. What have you been hearing? I mean, it's obviously a very simple process, and I've been on the video on Solvet's website seeing the videos, so it's definitely a very quick one. But what are you hearing? What's the feedback?
Yeah, that's a big part of the feedback is the simplicity of use. No extra training, no new equipment. It's so easy to use. And producers who understand or who are focusing on stress mitigation and understand the health improvements that you can get out of that, minimizing stress, minimizing pain, they really like this as a tool, as just a simple, no additional steps way of implementing this. Like I said, there are other ways. You can give shots of painkillers and local freezing, but nothing is nearly as simple as this.
Can I just quickly ask, like, do you know, like, what the ratio is for producers who are attracted to more of like a pain management during these procedures versus kind of just following the more of the traditional ways?
That's a good question. I wouldn't have a number in mind, but I would say it's a few percentage points every year moving over to this.
Okay.
So
Gotcha.
I haven't seen a big jump in people all wanting to adopt this sort of thing, but it is something that when conversations come up, there's, I'm talking with a couple clients every couple of months who are interested in ways of doing this better.
Okay. Yeah, that makes sense. A bit of a slow adoption.
That's fantastic. And it's also really important to realize that if we have a Canadian company that's innovating to develop new products to improve our systems, that's also fantastic for our sheep industry in Canada. And it's really good to even look into the product and learn more just to support the innovation that's happening in our own country. So that's fantastic.
And this company really does do a great job of that. I have a lot of their products on the shelf where I used to have a hole on my shelf where something became unavailable, or there was just a product that I wished existed that didn't, and they've stepped in and filled that role.
That's wonderful. I'm remembering your presentation at Field Day, and you were very quick to point out that you need to wear gloves to do this because the lidocaine getting on your fingers makes your fingers go numb. So I think it's important to share with our listeners that this product will also numb the farmer who is working with the bands.
If no gloves, yeah.
If no gloves.
Yeah. I said it's not a difficult technical procedure, but if you're doing a bunch of lambs and you freeze your fingers after the first couple of them, it will be much harder to do the last.
It becomes a very technical procedure. Yeah.
Oh, man. Yeah, you don't want the kids getting in there and kind of like shooting the rubber bands at each other's faces.
No, or that becomes a whole other sport. Awesome. So there are other painful conditions in sheep that would probably benefit from pain relief medications. So what else is available for managing pain in sheep that maybe some of our producers wouldn't be aware of that are on your shelf, but not on theirs right now?
Yeah, there are a couple options. Sheep always suffer from the problem that not much is created specifically for them. So often we're using medication made for other species. But there's a lot of reasons why it's worth doing that. Lots of conditions we see every day. So, foot rot, pink eye, mastitis, uterine prolapse, a difficult lambing. These are things that every farm is experiencing on a fairly regular basis. And these are all things that cause pain and stress, and we can do something to help these sheep with. So the first medication we've already touched on is lidocaine. It's the medication that is in these bands, and there are a couple other forms of it that we can use. Most commonly is an injection, and it's just very similar to what a dentist would use, a freezing injection. And we may get a human form, exactly like what a dentist would use, or we may use a veterinary form, but there isn't one specifically for sheep. But you just have to bear in mind it is used very widely in all species. So even though there isn't a sheep-approved product, it is common practice to use it. It is something, again, it's given by injection, so there's a bit more technique to it. It is something we used to use when we were castrating sometimes on some farms to try to minimize pain and stress. But the lidocaine, the Lidobands have eliminated the need for that for the most part. But we still use it, some of the larger farms where they're going to do a lot of assistance at lambing or replacing uterine prolapses would be a common time when we would use an injection of freezing to make the procedure go quicker and more smoothly, less chance of damaging the ewe or injuring her. And the quicker and smoother it goes, the less long-term impact we're going to get on that ewe from setting her back from that painful procedure. The other main medication I like talking about is Metacam. I don't want to seem like I'm pushing any specific drug company, but Metacam is a product that's been around for maybe 15 years now, but I still am really excited about because the company actually went through the work to get a sheep approval on the label. So it is one of our few options that we know exactly what the meat withholding times are, how often to redose it, what dose to use, all that sort of thing, because the company has put the work in to do that. And it is a long-acting anti-inflammatory injection. So anytime you have pain, swelling, or inflammation, an injection of this can help minimize that. So again, a difficult lambing, if you give an injection of an anti-inflammatory, that ewe is much less likely to have mothering issues. If she's not in pain immediately after birth, then she's more likely to do a good job taking care of that lamb, getting up, licking it off, making sure it's nursing. She's less likely to get uterine infections from swelling, preventing her uterus from cleaning and draining properly. She's more likely to make enough milk to feed that lamb well, because she's going to get up and she's going to start eating and drinking again sooner and support good milk production. So lots of reasons in that scenario where a painkiller can be really beneficial. And you can extrapolate the same thing, whether it's pneumonia or foot rot or some other condition with a fever or pain associated with it. If we help that ewe manage that pain, she's going to get up, she's going to move around, she's going to eat, she's going to drink, she's going to take care of her lamb, she's going to recover faster. So those are my two that I get excited about, lidocaine and Metacam. I use them every day. I use them all the time, and I think they make a huge difference. And especially Metacam is easy to use. So it's a drug that I would like to see on every sheep farm.
Fantastic.
Yeah. So it seems clear that reducing stress leads to better outcomes for sheep. Beyond medical issues, what are some everyday stressors producers might overlook? How can low stress handling systems help? And what practical low cost adjustments can farmers make right away to ease handling stress on their flocks?
Yeah. So anytime that you have stress, you're going to have risks with it. And the two that I would see the most are handling stress and weaning stress. So if you're weaning lambs from ewes, or if you're mixing unfamiliar groups of sheep and lambs together, there's going to be stress involved with that. And having good handling systems and good, safe housing can really help minimize that. If you've got a setup where the lambs think they can get back through to their mom, they're going to be running the fences looking for a way back through. And it's just heartbreaking to lose a lamb because it got itself hung up in a wire fence or broke a leg trying to get through somewhere it shouldn't. Same when you're handling sheep, even if there's not the stress of weaning, there's always the stress of handling. It's a stressful event to chase a group of sheep through a handling system. So having done some work ahead of time to make sure you have a easy path for these sheep to follow, like curved runways without a lot of options for them to try to jump or climb or break through, funneling systems to crowd them in so it's a real logical flow in one direction, that can really help minimize the stress. If you can get that first sheep going, then every sheep behind her is going to be less stressed out because they're just going to follow the path. And it's heartbreaking to be working on a group of sheep and end up seeing a perfectly good ewe break a leg or somehow injure herself because there just wasn't an ideal handling system. And by ideal, I don't mean it has to be expensive. I don't mean you have to go and buy the best, newest thing, but just putting that work in, walking through the chute, looking at it from the level of a sheep to see, if I was a sheep and I was trying to be pushed through here, where am I going to want to go? Am I going to try to squeeze through that gate or jump over that low spot, or is there some way I could make it a more obvious, easy flow to prevent injuries and keep that stress low?
Excellent. So if a producer wants to start improving welfare but feels overwhelmed, are there sort of three concrete steps you could recommend? And what developments in products, policy, or training would you like to see to accelerate better care in the industry?
Yeah. We talked about how I get a couple of questions every year or every season about this, and it's like a slow incremental uptake, which I think is the natural, logical way for it to work. But I would love to see the industry putting out some more continuing education about, there are these options. These are the options. Here's where you go to find the information about them, and this is why it may benefit. So that's why I'm really excited about this podcast, because that's exactly what this is. And as far as, concrete first steps, it sounds kind of trite. I'm a vet, and I'm saying your first step should be talk to your vet. But really, I think that's a good place to start, especially if we're talking about Metacam injections or Lidobands. These are prescription products, so your vet is where you're going to have to get them. And your vet is going to be the one who can give you the training on how to use them, when to use them, what conditions might benefit from them. I guess that would be my first concrete step. And I would also say a lot of our sheep farms, I get out once or twice a year to see these sheep clients, and often it's in the middle of the night or it's in some sort of emergency. And I'm not necessarily casting my eye over the production practices on that farm to see, here's some advice on where you may benefit to implement pain control or reduce stress. So consider investing in a flock health visit to get a vet out at a convenient, low stress time to both of you, the vet and the client, so that you can take the time to think of some questions and work through them with your vet about where they could make some recommendations for this sort of thing. Part of that, I guess my step 2 would be, I would love to see every farm already has a small bottle of Metacam on their farm. That would be the most important medication from a pain control perspective. And your vet can prescribe that for you. They can prescribe a small amount, so you don't have to spend a fortune on buying a big bottle of it at a time. They can give you a list of reasons why when it would be beneficial and how to use it. And I often get phone calls from producers where they call in because they have a problem. They want to do something to fix it. They're not sure if they need to have a vet out. And if they have a bottle of Metacam on the farm, sometimes I can just talk them through what they can do themselves and know that we're taking care of the pain and stress in that animal. And then I guess my last recommendation, since we talked about handling setups, would be just, take a look through your handling setup, try walking through it, crouching down, looking at it the way a sheep would, and thinking, if I was a sheep, I probably wouldn't want to run down there because there's a lot of scary shadows and no sheep down there. It's a long, empty runway. What good is going to happen to me down there? So think about that, how the sheep are going to want to move into and move through your system.
That makes sense. You got to put yourself in their hooves.
Yeah, exactly.
I know I do my best work when I'm not stressed or in pain. So this all really makes sense and can be applied to every human being.
Yeah.
So if people want to get their hands on the Lidoband or would love to just reach out to you specifically, how can they do that? How can they reach you or the Lidoband?
Yeah. So you can look up the company's website, Solvet. They have some videos available demonstrating how to use that band and some information about the band there. So if that's specifically what you're interested in, that's probably the best route to go. Again, Solvet, Solvet. If you wanted to reach out to me, I'd be happy to chat about it too. You can send an email to me through my clinic website, which is ptbovets.ca. We're Peterborough Veterinary Services, so that's just the short form for us. And I also have an Instagram profile, Peterborough Vet Services. I don't use it very often. There's not a lot of new content on there, but maybe someday I will. So that exists too, if you wanted to reach out that way.
Okay, great. That's fantastic.
Fantastic. Well, thanks for joining us today, Greg. It was really great to chat with you. And thanks for all your really amazing information about the Lidoband and also pain management.
Thank you. It was a pleasure. And I appreciate the chance to get some of this information out there.
Amazing. And thank you for listening. If you enjoyed this episode of Flock Talk, please subscribe through your podcast app to receive alerts to our future episodes. And please share our podcast with your friends.
For more Ontario Sheep Farmers content, follow us on social media. at Ontario Sheep Farmers on Instagram and Facebook. And of course, please visit our website, ontariosheep.org, for more resources.